One morning I woke up and I couldn't breathe. I remember my heart racing and coughing a lot. I was choking for air. That day I ended up in the ICU because of my condition. I've been experiencing long coughing and phlegms stuck in my throat for more than 10 years. Over the years, I consulted both private specialists and public hospitals as well as TCMs. None of the doctors could cure my symptoms. One morning I woke up and I just couldn't breathe. I went to A&E with my wife. This time the radiologist confirmed I clearly had bronchiectasis. Finally, there was a medical name to my condition.
Well, in my practice, we actually see quite a fair number of patients with chronic lung disease. So for example, we see a lot of asthma. Some of them are children, some of them are elderly, but when we go to folks who are elderly, I will start to think whether it might be something else, like chronic obstructive pulmonary disease. So COPD itself, I feel in Singapore is actually underdiagnosed.
So I'm a clinician scientist, which means I spend some time seeing patients in the hospital and the rest of my time in the laboratory here at LKC Medicine. I noticed that our patients with lung disease who are Asians actually present differently, are exacerbated by different factors, and most importantly, respond differently to the same treatments we would give them in other countries.
At the Terrace Centre, we have started the first multi-centre Singapore Severe Asthma Registry to improve understanding of severe asthma, collect evidence of treatment effectiveness and safety, and identify predictors of treatment success.
We have shifted the paradigm in understanding how microbes in the airway interact and crosstalk with each other rather than just being there in isolation. The original mission of TARIF was to bring research to patients through partnership, but now we need to bring the patients to the center of that.
The TARIF Centre aims to fill a clinical and knowledge gap on respiratory diseases among Asians and to develop personalised and precision medicine treatment tailored for local patients with lung disease. We aim to be an academic centre with strong interdisciplinary and transdisciplinary collaborations, having both local as well as global impact. In short, we want to bring research to patients through partnerships, thereby improving outcomes that matter for patients with lung diseases. What is unique about the TARIF Centre is our multidisciplinary aspect, our reach and our depth. Firstly, we bring together a team of scientists, doctors and nurses, industry partners, policymakers and patients to improve lung health for Singaporean and Asian patients. Secondly, we have more than 500 active interdisciplinary members and have established 46 local and international partner groups from across the fields of academia, healthcare, industry and government. Lastly, to advance our understanding on Asian patients, we need local studies and local Asian data. In this aspect, we will expand our reach through our 5 research pillars. The TARIF Centre is setting up the TARIF Patient Network, a platform for patients with chronic lung disease to partner with clinicians and scientists. In bringing patients' voices to research and developing patient engagement, we are also building the capability and capacity of our patient partners and researchers through workshops and training programs. This is the first of its kind patient panel for respiratory research, where patients will provide inputs on research direction and design so that they are relevant and share their lived experiences to help researchers understand what matters to them.
By understanding this illness a little better, I think I've learned to cope and manage my illness better. This allows me to engage in my favorite activities like birding, tai chi chuan, so I can live a more normal life. So the reason why I want to join TARIF is to share my experience with other patients. Then I'm also happy that I can be a research partner helping to shape the research on this illness.
I'm looking forward to more interactions in a group setting where different stakeholders come together, the researchers, policymakers, creating a safe space for everyone to have an open conversation.
By partnering with patients, understanding our experience with the lung condition, ultimately my hope is we can achieve a cure.
A patient once said to me, "If you can't breathe, nothing else matters." By bringing research to patients through partnerships, we hope that the TARIF Center will help our Asian patients breathe better.